Hello, this is Dr. Pat Sharp Brown. I'm a licensed mental health counselor in private practice, and I unfortunately have had the experience of losing not only one beloved husband 20 years ago after a 27-year marriage, but also my second husband after an 18-year marriage that was just wonderful. Both of the marriages were wonderful. So I'm just offering some tips for folks that are struggling with surviving after loss. And I have found that oftentimes you want help with how to do this and you don't know where to go. So I'm hoping you've Googled grief or working with grief and you've come across this little video. I have lots of little videos, and if you go to that website on the screen, Thriving Despite Grief, there'll be a whole list of different videos you can look at. So I'm going to talk today about trying not to do your grief alone. It just doesn't work. It's too overwhelming. And at first, when you lose your loved one, you're going to feel completely out of it, like disbelief, numb almost. You'll find you won't be able to cry, or you'll cry at the drop of a hat at something that doesn't seem appropriate to cause you to cry. That's all normal. That's all part of grief. And it's kind of the first stage of shock, where you often you just can't get your brain wrapped around the fact that your loved one is gone and he's not coming back. But for us Christians, it's a marvelous time to practice our gratitude and our appreciation in knowing, if our loved one was a Christian, knowing where he is or she is, knowing that they're with the Lord, knowing that the Lord has called them home not a second too soon. It's just it wasn't on our time schedule. It was on his. At any rate, at first you won't be able to cry. And C.S. Lewis is a wonderful author that I just really like. And he has a book about grief, grieving the loss of his wife, Joy, from cancer. And this is probably back in the 60s, I'm going to say, maybe late 50s. And he talked about feeling like he was just walking around with a concussion, that being sort of out of it in that way. So in order to not do this alone, almost within the first couple of days, it's very important that you start creating little tasks and put them on separate index cards or on separate pieces of paper, whatever. But as they come to you, things you know that need to be done that you're just not up to doing. Picking up clothes at the cleaners, doing your laundry, grocery shopping, picking up medications that you need, any number of things. Just start writing them all down. And then when somebody says, and they want to help, and somebody says to you, what can I do to help you? You will have this list of things, ready to go, because you're going to help them too, because they want to help you. They just don't know what to do or how to do it. And oftentimes if they make a suggestion, like, can I go to the store for you? You wind up saying, oh, no, I don't need that. Take advantage of that. Use that. Allow yourself to be pampered and cared for. This is a really important part of grieving. And grieving partly is realizing I'm alone now. And it'll help you realize you're not totally alone. You're alone without your loved one, the main love of your life, but you're not alone. So keep making those lists as long as you need them. You can write them for weeks or months, or sometimes folks even wind up doing them for 6 months to 7 months out from their loss. And it really helps those that are trying to help you. All right, that's enough for our first session. Keep your chin up. It does get better. Bye-bye.